when these movement patterns are inefficient, you're going to develop strength in your muscles in a less optimal way. Let's take the squat for example.
Definitely.
Okay, so we everybody wants to, squatting is an essential life movement. We all got to get up and down out of a chair. We all got to get up and down off the toilet. I mean,
There's your squat
there we go.
right there.
It's very common. It sounds funny, but I actually deal with people now where I'm getting, because of the sports medicine specialist certification that I acquired about 3 years ago, I'm getting a lot of rehabilitative clients, people in their late 50s, early 60s, 70s, who are having trouble picking things up from a low shelf, putting it on a high shelf, or grabbing something from a high shelf and bringing it down to a low shelf because their movement patterns are inefficient, their balance is off, yada, yada, yada. So with the squat, for example, the movement needs to initiate typically through the gluteus, and so if you're very far forward with the movement because you have a lack of ankle mobility and calf tightness, hamstring tightness, and hip tightness, that movement's the brain is going to use less of the glutes and more of the quadriceps and begin over time to irritate the tendons that are around the knee, and this is why a lot of people experience anterior knee pain.
So going back to what we were talking about before, when there's a muscle imbalance, may it be a strength or a weakness, your joints, your other parts may actually be more asymptomatic or painful, even though that source of knee pain is coming from the hamstring or a tight calf or an ankle issue too.
That's exactly what I'm saying.
I want to make sure. Yeah. Again, it took me $200,000 to learn how to do that too. So a lot of it is, I think, is when we get down to it, is can we have a good muscle balance, joint range of motion so far as we get through this talk. And at that point, when we have that, then our motion of getting up and out of a chair, getting stuff from the top shelf, bottom shelf, or vice versa, allows your body to feel loose and strong at the same time. And the confidence we're not going to hurt ourselves.
Yeah, it's the optimal. You're using all of your muscles, what I think an orthopedic surgeon would refer to as synergistically. Okay,
yes.
A strength and conditioning guy, rehabilitative guy like me is just. I use the word optimal a lot, right? And all I'm saying out there, you guys, is that you want to use the muscles the way they were created to perform. When your body's not in that state of optimal mobility and flexibility, which you can summarize as movement quality, you don't get this.